The National Education, Health and Allied Workers Union, Nehawu, is set to picket outside the union buildings tomorrow. The union is unhappy with the lack of response from President Cyril Ramaphosa following their National Day of Action. Earlier this month, Nehawu took to the streets demanding safer working conditions and a wage increase for its members. We are now joined by Nehawu General Secretary Zola Saphetha. Mr. Saphetha, a pleasure to have you on the program. We understand that the two main issues that Nehawu wants the government to address, that's the safety of healthcare workers against COVID-19 and the NSFAS wage negotiations, which are deadlocked. Just take us through your demands, please.
Good afternoon, Nhlanhla and the viewers. Indeed, we have submitted a memorandum of understanding to the President on the 3rd September this year, and he has not responded to that memorandum. It's precisely that reason, therefore, that the National Executive Committee decided to go physically and fetch that response from the President as from tomorrow until the President gives us the report. So I'm just arriving at a point where we're meeting just to get a briefing on the preparations, and then tomorrow will be the hearings and indicate how is it responding to our issues.
But the country has overcome its peak in as far as COVID-19, saying that it's not much of a risk. What's your stance on this matter? And just again highlighting the safety of workers.
As we said as from March, that we are really not, we refuse to be caught up on the discussion of the peak time. Just between the 4th August to 11 September, we got new infections of the frontline workers, which is about 5,097, just the 37 days in between. So that issue that talks about decline, in as far as the frontline workers, we don't see it. Rather, we see an increase in terms of number of infections. And also there's an increase of about 17 deaths between the 4th of August and the 11th September. So we don't buy that. We still insist that we're not going to be where we are in terms of the number of infections and the level of death if workers were given adequate PPEs, if government and all workplaces had complied with the occupational health and safety, if the shortage of staff would have been attended and filled all the vacant funded posts to respond to the challenge of the COVID. So we still insist that those areas remain relevant because national infections and the level of death in particular speaks volume as it relates whether or not we are still affected or infected by this virus.
And what are you hoping to achieve through this picket at the union buildings?
What we want to achieve really is the President coming to us and say, on the list of demands that we have raised, this is an extent to which we can meet you as government through engaging with the President, but to submit grievances and also demands of the public servants in the highest office in the land, and nothing has happened as if there was nothing brought to the attention of the President. It's unacceptable because it doesn't, and also it doesn't become exemplary for other offices as and when matters brought to the table attend to them. The President had ignored the memorandum of workers or employees under his government. They had to attend to that. Otherwise, these workers are going to perish and there will be no one to attend to communities as and when they come to hospital.
And as a side note, before I let you go, Nehawu is also adding its voice to calls for the Limpopo Premier Stan Mathabatha to step down for his inaction against fraud and corruption in that province. What is your stance on the matter, and why do you want to see the premiers back?
Nehawu is just one of the affiliates of COSATU, and that decision in Limpopo is a decision of COSATU, and Nehawu has participated in that decision. So there's no reason for Nehawu at the provincial level to distance itself. It's a collective decision of all affiliates of COSATU, and at national level we support our provinces because they've considered many things arriving in that decision.